welcome to our webinar on gamification and medical education today. So today we have Dr. Shaqil Peermohamed, who is an infectious disease specialist and an assistant professor at the Saskatchewan Health Authority. So Dr. Peermohamed has been organizing medical education games for his residents for many years and recently collaborated with Firstline to launch a case of the month and also the Microbial Pursuit, the daily trivia game. I don't want to spoil too much of the surprise, so I'll pass that over to Shaq right now to start.
Awesome. Thanks, Holly. So thanks for having me today for the Firstline Salon series. I'm super excited to present on the topic of gamification and medical education. And there's my email address and my Twitter handle as well, in case you have any questions or want to reach out after the presentation. So I have three major objectives for today's presentation. I want to talk about three really cool, innovative projects that we've done over the last year or so. So the first one relates to an antimicrobial stewardship escape room. The second one relates to interactive app-based cases that we've done in Firstline. And then the last project that I want to present is on Microbial Pursuit and some really cool data and findings that we've seen so far. So over the last decade, there's been a huge surge in serious games in medical education, and we can see a range of different platforms, including video games, app-based games, card games, and even board games that are expanding into the realm of medical education. And serious games are taking a game and taking it one step further. So the adjective serious in that term relates to it having some sort of educational value. And these are being used not just in healthcare, but in business and many other industries as well. So the first project that I want to talk to you about today is a project we did related to antimicrobial stewardship escape rooms, and we tested this amongst first-year internal medicine residents. So what is an escape room? Well, an escape room is basically a simulation-based activity where you're locked in a room and have to solve a series of puzzles, find clues, and escape from the room. So escape rooms are definitely gaining prominence as educational platforms and can be an effective tool to help students work collaboratively and communicate effectively as a group. These are an innovative tool in medical education that augments knowledge acquisition, complements medical simulation-based learning, and consolidates traditional education. Escape rooms in medical education create an innovative learning environment and expand opportunities to engage students and staff and promote high quality care to ultimately improve patient outcomes, which is our ultimate goal, I think, in healthcare. And when I was reviewing this topic, it's really exciting to see how much literature there has been about escape rooms, not just in medicine, but also expanding to other realms, including nursing, and then other specialties, including emergency medicine, critical care, radiology, dermatology, and more. So this is certainly a creative opportunity that fosters progressive, fun, and evidence-based learning environments that may positively impact patient care outcomes. So these are some of examples of literature that I found that are using escape rooms. And so I found examples not just in internal medicine, but also in nursing, emergency medicine, dermatology, toxicology, surgery, as well as radiology. And this is an example of an escape room that was held at a radiology conference and was a unique opportunity for residents, medical students, and attending physicians to collaborate in teams and do an escape room exercise at an actual conference. So that's a really cool idea. From this study specifically amongst the radiology residents, they saw high rates of residents reporting that they enjoyed the escape room activity. And when they asked students if they preferred didactic lectures to the game, that number was quite low, around a 2. So people certainly prefer more simulation-based active learning processes to our traditional approaches. And then taking it one step further from a learning perspective, the escape room was reported to help retain radiology information, identify knowledge gaps, and then also encourage the use of communication skills, collaboration skills, and leadership skills. And these are all very important aspects in healthcare when we think about our CanMeds rules and the types of attributes that we want our medical students and residents to gain before they ultimately transition into practice. So we thought that an antimicrobial stewardship escape room would be a very novel opportunity and a great chance to emphasize collaborative learning amongst our millennial and Gen Z learners. So millennials are defined as individuals born between 1981 and 1996, and they actually make up the majority of the current postgraduate medical education cohort. Our millennial learners are actually described as being technologically adept, goal-oriented, and socially confident. They value choice and variety and have a preference for collaborative team working exercises. So there actually is literature on how to develop an escape room in medical education, and we followed a 6-step process. Firstly, we identified educational objectives, and these were taken from the Royal College objectives of training for internal medicine residents. We identified 10 objectives that we wanted to tackle, and then we gamified each of those objectives and created puzzles. This ultimately required doing some field research and doing some escape rooms in the community, which was really fun, and then looking at different ways to gamify and create puzzles on those themes. And then we went to our local arts and crafts stores, found resources, built the escape rooms and the puzzles, and then collaborated with our simulation labs in Saskatchewan and Regina on campus to hold our escape room sessions. We also developed briefing and debriefing materials and evaluation materials to evaluate our educational activity. And then once we had a good sense of our escape room, we did some play testing with second year internal medicine residents, as well as some colleagues outside of internal medicine that were keen on escape rooms. And then we made some final refinements before going live. So these are the 10 objectives that we identified. I don't want to go through all of them, but essentially some of them included things that are relevant to internal medicine residents. So understanding the value of guideline-based empiric antimicrobial therapies for common infections, listing key adverse effects of different antimicrobials and risk of C. difficile infection, reflecting upon local antimicrobial resistance patterns and utility of antibiogram data, correlating pathogens correctly based upon a gram stain culture report, understanding the importance of avoiding prescribing antibiotics for conditions like asymptomatic bacteriuria, the importance of shorter durations of therapy for different infectious disease syndromes, different microbiological techniques to identify whether something is susceptible or resistant, and then just some general values and importance of antimicrobial stewardship. So in our escape room, we came up with this preamble, and this is kind of how we introduced the escape room to our participants. So this is what we read out to them just before they were entering the escape room. So in 1928, Sir Alexander Fleming discovered penicillin, described as the single greatest victory ever achieved over disease. He received the Nobel Prize for his discovery in 1945 and forewarned, the thoughtless person playing with penicillin treatment is morally responsible for the death of the man who succumbs to infection with the penicillin-resistant organism. Close to 1 decade later, we face an era of antibiotic resistance where 30 to 50% of antimicrobials prescribed in community and hospital settings is unnecessary. In fact, it's predicted that by the year 2050, more people will die from antimicrobial resistance than cancer. However, through the power of modern medicine and chronic preservation, Sir Alexander Fleming has returned to share his wisdom and help optimize our antimicrobial prescribing patterns. Sir Alexander Fleming has called upon you as a team of antimicrobial stewardship champions to help preserve his legacy and these precious resources. He's left you a series of clues to help find 5 medals, signifying the 5 rights of antimicrobial stewardship: the right patient, the right antibiotic, the right dose, the right route, and the right duration. Sir Alexander Fleming has written you a top secret letter, so you may wish to start there. But alas, my friends, science is not perfect. Sir Alexander Fleming has fallen ill with a mysterious infectious disease. In order to save him, you must find the 5 rights of antimicrobial stewardship and prescribe Sir Alexander Fleming the right antimicrobial. Be sure to check out the top secret letter he's left you, and he's also available to help you along the way. Help protect these precious resources and save Sir Alexander Fleming before he meets his demise in the next 70 minutes. That's kind of what we read out to introduce the goals of the game before the first-year residents enter the escape room. And so, like I said, we held these escape rooms in our simulation lab on campus. And so we had access to really great technology and one-way mirrors so we could view the residents as they progressed through the escape room. We had TV screens that we could operate behind the scenes, and they also had a laptop in the escape room so they could access Firstline and any key resources and guidelines they needed during the escape room activity. So this is kind of where we were sitting watching the residents as they progressed through the escape room, and we could use cameras to zoom in on their progress as well. There also was a mannequin in the room that played the role of Sir Alexander Fleming, and we were able to communicate to the residents and provide hints if they needed and answer any questions they had during the escape room activity. So we had a variety of different locks in the escape room itself. We had some different keypad locks and a cryptex lock that you might recognize from the Da Vinci Code. So lots of different locks that we could use for our escape room. This was a really cool puzzle redesigned where they had a series of 7 rules to follow, and they had to put different antimicrobials in the correct columns and the correct rows based upon those 7 rules. So one row might have said all of the antimicrobials in the top row have to have activity against MRSA, or one of the columns might have said all of the antimicrobials in this column represent an empiric regimen for a patient suspected of having community-acquired bacterial meningitis. So they had to get things correctly in that grid to move on to the next puzzle. This was an antimicrobial formulary that's in the middle that we hid amongst different books. So we hid that, and that actually seemed to be one of the most common things that students struggled with, was to find that hidden antimicrobial formulary. But that was a unique aspect of our escape room. So in that formulary, it had costs for different antimicrobials. They had to add them up, and then that opened up another lock in the escape room. We had backpacks, we had other different types of locks you can see there as well to fill in the space. On this one, you can see that they had to correctly match an antimicrobial with the side effects and toxicities associated with that antimicrobial. Once they did that, certain numbers would be crossed out, leaving a series of numbers that would help them advance to the next clue and open up another box. On the left here, this puzzle helped students interpret gram stains. So they had a list of bacteria and then had to correctly follow, based upon gram stain interpretation, which gram stains correlated. And then if they did that correctly, it actually creates a letter. In the top right, we had different patient charts and file folders, and they had to identify which patient needs treatment for asymptomatic bacteriuria. And then the bottom right, we had a puzzle relating to risk of C. difficile infection with different antimicrobials as well, and appreciating those risk profiles. We also gave students an opportunity to learn a little bit more about things that are done on the micro side of things. So they actually had pictures of Kirby-Bauer diffusion tests and agar plates to correctly determine whether antimicrobials were sensitive or resistant. And then if they correctly did that with the toggle box that you can see on the left, then the green light would shine, allowing them to advance to the next puzzle. So these were some of the metals that they had to find. There were 5 of them in the escape room. And we also had puzzles on antibiograms and interpreting antibiogram data. So for this part of the puzzle, they had to look at antibiograms and find the correct numbers, and that helped them to unlock a USB key, which then had a cameo video with Dr. Glockenflecken. So we were able to collaborate with him, and he made a really awesome video for us, giving a series of 6 clues about 6 different antibiotics. And there was a compass in the escape room. So once they identified which directions corresponded to those clues, they were able to solve the direction lock and open up a backpack. Dr. Glockenflecken was absolutely fantastic to work with and collaborate with on this. He ad-libbed a lot of jokes, which were not scripted, which the residents found super fun and entertaining during the escape room.
Hello residents, it's Dr. Glockenflecken. How you doing? I hear that you have an escape room puzzle to figure out. All right, so it's my job to provide you with some clues to help you come to the right solution. And in solidarity with you guys, I think this puzzle, this escape room, there's a backpack involved, maybe a compass. I don't have a compass with me, but I did find a backpack. It's my daughter's. It doesn't fit at all. And it's very shiny. It's got like glitter all over it. It's great. And I also have my clues here. So I'm going to read you each of these 6 clues, okay? So we're going to start with the very first clue. Here you go. Are you ready? All right. This carbapenem crosses the blood-brain barrier. Yeah, I didn't know that carbapenems didn't cross. There are some that don't cross the blood-brain barrier. I assume they could do anything because they're carbapenems. Isn't that like the strongest antibiotics we have? Now keep in mind, the only antibiotics I've prescribed for the last 8 years are eye drops. So this is all new information to me. Okay, that was the first clue. This carbapenem crosses the blood-brain barrier. Clue number 2. This 3rd generation cephalosporin has activity against Pseudomonas aeruginosa. This 3rd generation cephalosporin has activity against Pseudomonas aeruginosa. I'm very familiar with Pseudomonas. King Pseudomonas. All right, the taker of eyeballs, the destroyer of corneas. All right, that was clue number 2. Clue number 3. This carbapenem has no activity against Pseudomonas aeruginosa. You don't want it. All right, if it doesn't have any activity against Pseudomonas, you don't want it. Okay? This carbapenem has no activity. Why even make it? What's the point? Who's making these antibiotics that don't treat Pseudomonas? All right? We always need to be treating Pseudomonas. Always be treating Pseudomonas. All right, 4th clue. 4th clue. This fluoroquinolone poorly concentrates in the urine and should not be used to treat urinary tract infections. That's right. This fluoroquinolone poorly concentrates in the urine and should not be used to treat urinary tract infections. It doesn't concentrate. Not in the urine. All right? It's not there. Don't use it. All right? Don't use it for UTIs. How many times do we have to tell you guys? Do you guys know all this stuff? Ah, you're really smart. Okay, the 5th clue. You ready? You ready? 5th clue. All right, you guys, you're going to have to like edit these and separate them out so you're not all getting clues at once. But the way Cameo works, I just have to basically just make one long video. All right, 5th clue. This antimicrobial has reliable activity against both MRSA and VRE. MRSA and VRE. If I say VRE, does that make your brain short circuit? That's probably like one of those like pet peeves. MRSA or VRE. No, I'll say VRE. This antimicrobial has reliable activity against both MRSA and VRE. Just says antimicrobial. It could be any of them. Or who knows? Who knows? There's so many. There's like at least 6. Yeah, maybe 7. I don't know. Okay. Last clue. Here it is. Clue number 6. The oral formulation of this antimicrobial can be used to treat C. difficile infection. The oral formulation of this antimicrobial can be used to treat C. difficile infection. That's it. Those are the 6 clues. Hopefully you solved it. Hopefully you guys know all the answers and can open up your backpacks, use your compass, and get that $1 million, which is probably what I can't imagine what else the prize would be. So anyway, I hope you enjoyed it. All right. I'm glad I got to participate. And best of luck to all of you. I hope you escape because you guys got work to do. All right. Yeah, there's patients to be, you got some consults to go see. All right. So I wish you all the best. Take care.
So like I said, we came up with some different briefing and debriefing elements, and this is a really pivotal part of an escape room. The briefing elements really give an opportunity for introductions, objectives, expectations. Also helps us to show the residents how to use different locks so that they don't get hung up during the escape room. We didn't permit them to use any sort of other electronic devices apart from the laptop in the escape room itself. And then also just emphasizing the importance of confidentiality. This escape room activity was purely formative. It had no impact on their residency performance evaluations. Then we had debriefing elements. So after the escape room activity, we did a debriefing session where we went through each of those puzzles, and that allowed for a lot of feedback, reflection, and reinforcing key concepts and learning on the escape room activity itself. So now we can kind of show you some data. So for the evaluation piece, we use a tool called a retrospective pre-post self-assessment tool. So that essentially means that after the escape room activity, they ranked those 10 objectives on a scale from 1 to 5 in terms of how well they think they can do them. And they retrospectively thought about how well they could do them before the escape room, and then how well they could do them after the escape room. The reason we didn't do a traditional evaluation where we ask the students before the activity to do an assessment and after the activity is because that can lead to some anchoring, and then students may already have an idea of what the escape room is going to entail if they have access to those objectives beforehand. The other advantage of this type of tool is that you're asking for an assessment at one point in time as opposed to 2 different evaluations. It also reduces response shift bias. It's more valid and more convenient. So that's the type of tool that we used for our evaluation. And so now what I can show you is some of our data. And this is data from last year when we first did this activity. So we had 6 antimicrobial stewardship escape room sessions, 4 in Saskatoon and 2 in Regina, for a total of 24 PGY1 or first year internal medicine residents. And each team consisted of 3 to 5 residents as well. So like I said, there was a 10-minute orientation and briefing session, and then they had 70 minutes in the escape room session itself with 3 to 4 hands provided. And then the debriefing was 20 minutes. So these were our 6 teams, and 5 out of 6 teams successfully escaped the escape room, and these were the times remaining for those different groups. So a bit of a range in terms of the number of minutes needed for those different groups to escape. So this is an example of our pre and post scores for one of our objectives. And I'll show you another table that has all of our data, but this is just an example of one of our graphs. So like I said, each of those thin lines is each individual student. And then the thick purple line is the average score pre-escape room and post-escape room. So how well they think that they can, how well they understand local antimicrobial resistance patterns and the utility of antibiograms. So these are all 10 objectives, and in the columns you can see the pre-escape room score and the post-escape room score, and then the change and reused a Wilcoxon-signed rank test to analyze our data. And so for all 10 objectives, we achieved statistical significance. We also performed a Bonferroni correction as well, and our results remain statistically significant. We also collected some narrative feedback from the residents during the debrief and evaluation activity. And these are some key terms that stood out. Students described the activity as enjoyable, fun, effective, and also leading to knowledge translation. These are some pictures of the residents during the escape room and taking some photos that they escaped from the escape room. So that was always something fun to do afterwards. Some key comments that stood out as well. Residents said that this was a great interactive way to dive into antimicrobial stewardship, and they would recommend this to all residents in any program. The debrief session was identified as being very useful, a great learning exercise, but also improved confidence and identified gaps, and an extremely fun way to learn. And then another student said that this was a fun and interactive experience that promoted recall and new learning within infectious diseases and antimicrobial stewardship. So I think in conclusion, our study and our data definitely supports that escape rooms are one example of a more learner-centered, team-based method, which can be very essential to the practice of safe, modern healthcare. And our residents had an overall positive perception of the antimicrobial stewardship escape room and perceived learning through this innovative activity. So escape rooms are certainly not the only way to teach concepts related to antimicrobial stewardship, but I think it's one potential tool that can be in our toolkit to teach antimicrobial stewardship, especially above and beyond our traditional didactic lectures and traditional approaches to teaching stewardship. I think further studies are certainly needed to determine long-term retention of knowledge and whether this type of activity actually changes prescribing patterns or improves patient outcomes at the bedside. So there were some limitations with this study. It may not be feasible for all antimicrobial stewardship programs to employ escape room sessions based upon labor, logistics, and resources and coordination. With the tool that we use, there is the potential for self-report and social desirability biases. And of course, like I said, it doesn't assess long-term retention or impact on actual prescribing patterns. I did want to just quickly acknowledge some of the collaborators for this study, including Chantal Lecure, Dr. Joshua Lawson, and Dr. Marcel Deon, that helped significantly with the data analysis and evaluation tools and concepts to employ for this study, as well as our play testers, the University of Saskatchewan Clinical Learning Resource Center and SimLabs, as well as Dr. Glockenflecken and Sparrow Coffee for giving us some of the escape room tools and that were used for the activity. Okay, so before we move on to our second project, I wanted to share a little bit about myself. So I have been practicing in Saskatchewan for the last 6 years in infectious diseases and antimicrobial stewardship. And it's been really exciting because I've been able to do lots of really cool, innovative projects, especially related to medical education. And that's certainly become a bit of a passion of mine, and looking at novel ways to teach antimicrobial stewardship and infectious diseases. So my other passion is escape rooms and puzzles. And then one of my other guilty pleasures is Survivor. So I still watch Survivor to this day, which is currently in its 43rd season. So I started watching when I was in grade 7. So I was 12 years old. So that's a bit interesting to think about how many years Survivor has been on, and I don't think Jeff Probst has aged one bit. So on the first episode of this season of Survivor, they had a puzzle for the teams to solve in order to get access to different resources. So I've kind of replicated it on the screen for you. So here you can see the numbers 5080. And you can jot this down if you want to try and solve it, and we'll talk about the solution at the end of the session. But your challenge is you have to move only 2 of these lines. So you can only move 2 lines to make the biggest whole number. And you can only move 2 lines. Yeah, so I'll give you a second to kind of jot that down. And then we'll if you have the solution, you know what it is, feel free to enter it into the chat box. But I thought that might be a cool interactive way to present a puzzle to the group. So the second project that I want to talk to you today is about a collaboration with Firstline and using our Firstline app as a way to present cases to learners and residents and staff and engage them in an app with a case of the month. So in Firstline, we started doing these cases of the month in Saskatchewan starting in January. And we have 9 cases. We present a new case every 3rd Thursday of the month. And the cases are accessible in our guidelines section under education. This is an example of January's case that was all about asymptomatic bacteriuria. So the correct answer here was D, that no antimicrobial treatment was indicated. So in the app itself, learners have access to all of our cases as they accumulate over time. And they can go back to prior cases and test out their learning and go back to ones they've already done before. They can engage and interact with the case, and then the algorithm is created and set up so that way they get feedback whether they were correct or incorrect. They get information, including some different clinical insights about why those choices are correct versus incorrect. And then they also have an opportunity to provide us with feedback on the case, rate it from a scale of 1 to 5, and then let us know if it improved their knowledge of asymptomatic bacteriuria and whether it'll change their prescribing practices in the future. They can also give us comments, ideas for future cases. And then we also include some different references as well to provide more learning opportunity and references for each of those cases. So I was just tallying up the data last night for our 9 cases so far. And so we've had over 1,300 accessions for our 9 cases so far. So it'll be exciting to do cases for October, November, and December and have a full year's worth of data. Looking at our average case rating, so of our data, we had 178 people respond to our feedback survey that's at the end of each case. And they've rated our cases on average at 4.9 out of 5. And then when we also asked whether this case has improved their knowledge, about 92% of survey respondents agreed that the case has improved their knowledge. And then 86% agreed that the case will change their prescribing practices. So that was really exciting to see. I'm going to be taking another step and looking at the data a bit more in detail to see if people answered the case correctly versus incorrectly, and then see if there's any difference in those ratings of whether the case improved their knowledge or changed their prescribing practices. But this has been a really cool way to collaborate with Firstline and have an opportunity to do some interactive cases, engage with our users, and present a new case each month. So like I said, I love puzzles, and I don't know about you, but I love Wordle. I'm addicted to Wordle and these sorts of puzzles. I play Wordle every day. I'd be curious if there's a game similar to Wordle or another type of puzzle activity that you play every day. If you want to jot that into the chat box, there's lots of different examples out there. There is interesting other variations of Wordle, like Knuckle, which is a Canadian version, Foodle, which is all about different types of food, and then I think there's even a variation of Wordle that is all about artwork. And so there's different examples of kind of different daily puzzles that people can play. And it's been a great way, I think, during the pandemic to engage and share online through different social media platforms, and definitely gaining prominence as an educational opportunity as well. So that brings us to the third project that I wanted to share with you today, which has been really, really exciting. And so this was a project called Microbial Pursuit. And so I had approached Holly and Firstline to talk about an opportunity to maybe create a game that was based upon trivia and also the wonderful world of infectious diseases. And use this as an opportunity to engage people and test their microbial knowledge with different viruses, bacteria, parasites, fungi, and antimicrobials as well. So it's been absolutely phenomenal to collaborate with Firstline on this, and really exciting to see all the steps it took to build this game, and really exciting as we're going to add more features and enhance the game moving forward. So I'm going to do a demo and we'll play today's Microbial Pursuit as a way to kind of show you the game if you're not already familiar. Okay. So on the screen, if you go to firstline.org/microbial-pursuit, you can access our game. So I'll quickly just start with the learning how to play. So each day we have a new puzzle. And with the puzzles, you can request up to 4 clues to help you guess. And the clues do become easier as you go along. Each time you advance to another clue, your score drops by 25 points. If you answer correctly on your first clue, your score will be 100 points. If you answer correctly on the next clue, your score will be 75 points, and so on. You can review prior clues. You can go back to those prior clues without losing points. And then when you think you know the answer, you click the answer button, type it in. We have a bank of all of our pathogens and antimicrobials. And we're looking for the drug name or the pathogen name, not the brand name of the drug or the name of the disease or syndrome. So we also have all of our previous games listed. So if you want to go back and play prior games or test your knowledge and go back to prior games, you can always do so as well. So we'll play today's as an example. So we just click play. Get ready, guess the name, 4 total clues, 1 correct answer. So the first clue says, I was discovered by Carlos Chagas in 1909 in Brazil and mistakenly interpreted to be a trypanosome. I was reclassified as a fungus in 1988. So if you know what the answer is, feel free to quickly type it into the chat box. And as an example of answering incorrectly, for example, let's say someone read that first clue and thought maybe this is Chagas disease and caused by Trypanosoma cruzi. They could type that in, push submit answer, and then the game would let them know that it doesn't seem right and to try again. So then they would get access to our second clue. And infection is acquired by inhalation of my cystic form. During the 1980s, I became particularly widespread during the HIV epidemic and was responsible for 2/3 of AIDS-defining illnesses. So they might clue in at this point and think about some different opportunistic infections. And then they might want to go on to their third clue. My clinical presentation typically includes progressive exertional dyspnea, fever, non-productive cough. Classic radiographic changes include bilateral diffuse infiltrates and trimethoprim sulfamethoxazole. So sulfamethoxazole is the antimicrobial of treatment, antimicrobial choice for a disease caused by me. And I'll just show the last clue as well. Among individuals living with HIV, prophylaxis against me should be considered if their CD4 count is less than 200. Ceftra is the preferred antimicrobial agent for prophylaxis. Alternatives include dapsone, atovaquone, or aerosolized pentamidine. So at this point, they may know the answer. So then they could type that in. And push that in and then submit the answer. and then and they can also you can also share your score on Twitter, Facebook, and LinkedIn, and then also have access to previous games. We also have opportunities to discuss puzzles in the Firstline community, and you can also contribute puzzles as well. So if you have an idea for a puzzle, you can also submit that and contribute that as well. So we're continuing to work on more game features as well as more clues to continue with daily puzzles moving forward. So the next thing I want to do is show you some of our data for Microbial Pursuit. So in the first 2 months since launching Microbial Pursuit, and I believe we launched on July 5th, we saw a huge spike in terms of users, and that has leveled out a little bit. But I think what's impressive here is that over the last 3 months, we've maintained a good user database with around on average about 100 people playing per day. So we're going to be doing some more outreach to different residency training programs and universities to help promote this tool. I think the puzzles, as you can see from today's example, it's a good range and a good breadth, combining knowledge not just of trivia and history and eponyms related to different pathogens, but also more relevant clinical pearls related to clinical disease and presentation, as well as laboratory findings or key antimicrobial treatments for different pathogens. On a global scale, Microbial Pursuit has been played in over 50 countries. So I believe it's at 57 countries that Microbial Pursuit's been played in. And these are the top 8 countries. So Canada, United States, United Kingdom, Spain, Australia, Mexico, India, Italy, South Africa, and Saudi Arabia are the top 10 countries in which Microbial Pursuit's been played so far. I was also going through Twitter last night to look at some key feedbacks and things that people have said about Microbial Pursuit. So like I said, you have the option to share your score and share that you solved Microbial Pursuit on different social media platforms. So some things that stood out to me were people saying, this game is the new Wordle for microbiologists, get involved. Another person said, guess I have a new replacement for Wordle. I might be biased, but I think I like this better than Wordle. Great daily trivia game. I love this. Great brain teaser for people who make antibiotic choices. Oh my God, I actually retained some antimicrobial knowledge. This is satisfying a craving I didn't know I had until Wordle arrived on the scene. Another person commented on our 77th puzzle saying this one was too easy and this one was simple for him. So someone else said, I do love the compliments you get when you demonstrate your micro geekery on Microbial Pursuit. Micro friends, if you aren't playing this, you should be. Bill said it was a second clue that helped it click for him for a 10th puzzle. Empiric said that they like the ones about antibiotics. Bruce said for our specific puzzle about an antimicrobial that covers C. difficile infection, that one flowed right out of him. So a nice pun. Another person commented on seeing a case of that particular type of fungal infection for our 10th puzzle. And then Vindana commented 3 in a row, and I've been called a rock star microbiologist. And she also tagged some friends and colleagues on the puzzle as well to help engage other people with Microbial Pursuit. Okay, so those were the 3 projects that I wanted to present. So we'll come back to our little puzzle challenge for today. Does anyone have any ideas on how to make this the largest whole number by only moving 2 of those lines? Okay, so Holly said 9,990. So that's a solid guess. And this one was really challenging. And when I saw them solve it on Survivor, I was really impressed. I actually did not get this either. So what actually the solution is, if you move this one and this one, you can actually create 2 1s. And so then you can move those two sticks to the middle of 8 and 0, and you can actually make 511,810 by moving those two with the 0. This was a really hard puzzle, but this was a really cool one to see on Survivor. Okay, so I'll just end with a quote. Tell me and I forget, teach me and I may remember, involve me and I learn. I wanted to thank you again for the opportunity to present on gamification and medical education, and I'm happy to chat further and answer any questions you have as well.
Thanks so much, Shaq. That was an awesome presentation. So to all our participants, was there any questions in the crowd? I actually do have one myself, Shaq. I was wondering, to set up one of those escape rooms, how much time does that take you in preparation?
Yeah, that's a great question. It was a lot of hours, like between doing like different field research and designing puzzles and then play testing. Probably I'd say somewhere between 50 to 100 hours, like spread out over several months. During the pandemic, it was really interesting because a lot of different escape rooms in the community had virtual platforms that you could engage in. And that's also something that's being studied as well, because virtual escape rooms would also have the benefit of not necessarily needing that physical space and those resources, but doing something electronically. And then, of course, the reset time for escape rooms virtually is just as simple as a click of a button, whereas we actually had to go back to the escape room, the physical space on the simulation lab, reset everything before the second group came in, which also can be time consuming. And some centers may not have access to simulation labs and those sorts of resources.
Thank you. We have a question in the chat, actually, from Andrea. So yeah, so it sounds like there is a lot of work preparing for one of these rooms. So is this something that you feel like you would be able to share or like sell the package to other providers who might be interested?
Yeah, absolutely. I think there's like huge opportunities like to build the puzzles, and like you could even change around some of the puzzles as well, and make them more relevant to your center. Like if you wanted to change the antibiograms and look at other specific elements, you could tweak things for sure. So yeah, if you maybe wanted to reach out to me, then happy to talk more about each puzzle and how we built them and those sorts of elements. And I think there is also interest from different programs in Saskatchewan to replicate this for undergraduate medical education. But of course, changing the knowledge level or the theme of the puzzles, so it's more relevant. And then, of course, expanding outside of internal medicine would be interesting as well, because lots of other people prescribe antimicrobials. So this certainly could be beneficial for surgery, pediatrics, other different groups, and then just tweaking things to the most common presentations that they see and what antimicrobials are relevant to the types of patients that they see as well.
So one other thing that Shaq mentioned in this presentation was also the case of the month, which is really cool, and it's built right into Firstline. So if there's anybody who's interested in building their own for their site, you can also reach out to me, and I'd be happy to help you set that up. And I think that's a really great and easy tool, just something once a month. All right, so we have a question from Kimberly in the chat, and I'll just read it out. It says, what are your thoughts on social media playing a role in medical education?
So before we launched Microbial Pursuit, I was just like, it was really interesting to see how much of a presence infectious diseases has on Twitter. And there's definitely this concept of free open access medical education, or FOMED, using social media platforms. And it was really mesmerizing to see how many different people are presenting cases or showing a picture, or doing polls to find out about how people would treat something. And of course, everything is de-identified from a patient perspective. But there is lots of really cool ID trivia platforms out there, and lots of different Twitter profiles where they're asking key concepts related to infectious diseases, and then also sharing the latest evidence. So I think social media can be a very powerful tool, and I think that's definitely emerging as a platform to not only learn, but to also teach. It's also really interesting to see the number of podcasts and journal ID themed journal clubs that are out there. So I think the presence on Twitter and other social media platforms is definitely growing. And I found myself, like, through Microbial Pursuit, also using Twitter more, and following more people that are doing educational activities on social media platforms. So that's been really cool to see. And I also just saw, so Michael Hainan is on the call as well. So Michael Hainan's a third-year medical student at the University of Saskatchewan. So I also just wanted to give a shout out to him, because he was one of the collaborators on Microbial Pursuit, and one of the co-creators of Microbial Pursuit. So it's been really fantastic to collaborate with passionate individuals at Firstline and Michael, when it comes to different medical education projects, and taking an innovative approach and trying something new.
I think I'll add a cool thing about social media as well for medical education was that when we first launched Microbial Pursuit, most of the promotion went on social media. And it was really cool when Shaq showed that map with the countries, 57 countries globally. Most of those were actually just through social media connections. So people saw the hashtag and then they started sharing and playing. So to see that network effect spread so much quicker online, I think that's definitely something with that social media generation. Great. Did we have any other questions? Feel free to pop them in the chat. Another thing we do have is also the Firstline community. So, once this webinar is over, it would be great to keep the conversation going. So if you think of any ideas or have any questions for Shaq, he did post his email, but you can also feel free to pop it into the Firstline community for everyone to see. I know that World Antimicrobial Awareness Week is going to come up soon, and so people usually like to plan some ideas around it. So that'd be pretty cool to share. So if there's no further questions, I just want to say one last thank you to Shaq and everyone for joining us today. This was a very informative presentation, and hopefully it sparked some ideas for everyone for education tactics to teach your residents and providers. And if you haven't already, as Shaq demonstrated, be sure to check out Microbial Pursuit and share with all your colleagues and help us spread that. And so thank you again, and I'll put my email in the chat as well in case anybody has any questions or follow up.